Hello, my name is Michael Wang. I'm the Putin Clark Endowed Professor in the Department of Lymphoma Myeloma, MD Anderson Cancer Center, Houston, Texas. It is my pleasure to share with you some of my opinions on therapies in patients with relapsed refractory mantle cell lymphoma. 2020 ASH has been a very exciting ASH for mantle cell lymphoma. We have really have breakthrough therapies presented at this exciting meeting. I would like to put the therapy advances in three categories. The number one in terms of targeted therapies. Targeted therapies for BTK is one of the most successful targets ever employed in lymphoma. So with the three BTK inhibitors already proved with ibrutinib, acalabrutinib, and the newbrutinib, all proved for relapsed mantle cell lymphoma. There's a new addition to that. The new addition is orelabrutinib. Orelabrutinib is another second generation specific irreversible covalent BTK inhibitor binder. And this has continued to show good results in terms of overall response of 87%, a very reasonable 34% of CR rate in mantle cell lymphoma relapsed, actually in the Chinese population and in the Chinese population. So the similar trials are being conducted in North America and Australia. As we know, the first generation BTK inhibitor is ibrutinib. It is the covalent irreversible BTK inhibitor, and with the second generation acalabrutinib and zanubrutinib, including orelabrutinib, which belongs to the same second generation of BTK inhibitors, that's also irreversible covalent binding. But at this meeting, there's a first in-human clinical trial, a phase 1/2 clinical trial that I have presented at this ASH called LOXO 305. LOXO 305 is another small molecular inhibitor of BTK, Bruton's tyrosine kinase. And this compound, in contrast with the first and second generations of BTK inhibitor that's irreversible covalent, this LOXO 305 is the non-covalent reversible BTK inhibitor. In the first in-human trial with 323 patients, and the phase 1 study has no DLTs. The dosage is MTD is 200 milligrams. I'm sorry, not MTD. The determined dose for the phase 2 is 200 milligrams daily, orally, and with such even in 93% of patients that have already received the first and the second BTK inhibitors, LOXO 305 still on fourth-line therapy still had the response rate of 52%. This is a remarkable response rate, and not only that it is good for relapsed lymphoma, it's also good for other lymphomas. The second category is in the areas of antibody-drug conjugate, and at this ASH, I also presented the very exciting first in-human trial called VOS-101. VOS-101 target is a monoclonal antibody drug conjugate with the MSAE, auristatin E, which is the toxin. So as we know, this attacks the antigen on the surface of the tumor cells. ROR1 is a oncofetal protein that this protein was present in the embryonic development phase, but it disappears before human birth. But it will reappear. It reappears during the malignancy transformation, such as lymphoma. So this drug conjugate is a monoclonal antibody against ROR1 connected with a linker that's proteolytic linker with the MSAE toxin. So when the VOS-101 binds to ROR1, it leads to rapidly internalization, and after that, the drug goes into lysosomes of the mantle cell lymphoma cell, and in the lysosome, the linker was cleaved by enzymes, releasing the MMAE toxin, which in turn killed the cells. After 4 prior line therapy, at the 5th line, the response rate for mantle cell lymphoma is 47%. Very, very exciting. 2 out of 2 mantle cell lymphoma patients post-CAR T relapse also responded to this exciting drug. So this is, I already brushed you on the novel therapies targeted and drug conjugate. The third category is CAR T cells. Everybody know that the ZUMA-2 clinical trial led to the international approval. Led to the FDA approval of Bruxelles Cabazin autoleucel, and this CD19 CAR T cell therapy was approved on July 24, 2020 for refractory mantle cell lymphoma. At this ASH 2020, the Juno CAR T, BMS Juno CAR T, that's also against CD19 trial, phase 2 clinical trial, was presented by Dr. Leah Palomba from Memorial Sloan Kettering Cancer Center. And in this clinical trial, the overall response rate is 85%. The CR rate is very impressive at 66%. So I really think these are has been a very exciting year, very exciting conference for the patient with the relapsed mantle cell lymphoma. Thank you.